$15,000 later, we gave her a new face. Here is how I did it. First, let's focus on skin. We did Aerolase to kill bacteria and also reduce hyperpigmentation. We also started her on chemical peels. Then we sent her home with medical grade skincare to further the progress that the chemical peel and the laser did. And we completely cleared her skin before we started injecting. And here's what I did to balance out her facial features. First, let's start off with Botox, of course, just to give her some level of rejuvenation in the upper face. You can clearly see under eye hollowness, can also see facial sagginess, especially in the medial and lateral cheeks, severe nasolabial folds because of that cheek fat pad dissension, and also there's no support within that smile line area, and a receded jawline and her chin curling in that doesn't look soft or feminine, so we definitely did something about that. So here's the plan. We definitely need PDO threads. Sometimes cheek filler can lift these heavy fat pads, but it all depends on the severity. For her, PDO threads will not only rejuvenate it, but also give it more of a longevity. And I always consider that for my patients, what will last the longest. Now that her fat pads are repositioned in a lifted upright manner, let's replace volume loss. Again, there's volume loss around the under eyes and the smile line. We definitely did under eye and smile line filler. Usually when you get PDO threads and I'm trying to reposition your natural fat pads, sometimes there is still volume loss in the lateral cheeks. And so we did add a little bit of cheek filler to her lateral cheeks to give a smooth transitional layout. Now let's go to her chin and jawline area. You can clearly see volume loss around the chin shadows, and you can also see how that mental crease is very prominent and how her chin is curling in. I did full side profile balancing on this patient just to give her a more contoured jawline and a feminine looking appearance. So $15,000 later, with the Aerolase package, chemical peels, medical grade skincare, and also full facial balancing, here's her final results. As you can see, we got her skin to be a little bit more even. We're still working on minor texture and acne scars that's left behind. And clearly you can see what facial balancing did for her. It just elevated the look. The smile lines are gone. The cheeks are more repositioned in a lifted appearance. Her under eyes are more plump and hollow. Her jawline is more stronger and contoured.